What happens when your body turns against you in silence? In Uganda, thousands live with invisible conditions.
Every day, someone near you is fighting a silent battle. They may look okay, but behind the scenes, they are living with a condition that could change everything.
These are non-communicable diseases.
NCDs.
They don't spread like viruses, but they kill, and sometimes without warning. The cancers, diabetes, diseases of the heart like stroke, diseases of the lung, asthma, chronic obstructive pulmonary disease, among others, genetic disorders such as sickle cell disease, hemophilia, and many others. The list is endless. You've heard about them, but do you really know their impact? In this documentary, we journey into the lives of real people, survivors, fighters, families. We hear their stories, their pain, and how they're living with these NCDs, their resilience, their hope. And we ask one question: are we doing enough? Are we doing enough?
Non-communicable diseases, or NCDs, affect millions, yet they're rarely talked about until now.
The NCDs are preventable, and if you treat them early, you can protect yourself from getting an NCD, but you can also get better outcome if you get diagnosed early and get on treatment. So I'm encouraging the general population to go for screening, do medical checkup regularly to ensure that if in any case you develop an NCD, it's captured early, and once it's captured early, the outcome of the treatment or management are always good. Others can be treated and cure completely once it's captured early.
UNCDA presents The Silent Fight. Stories behind NCDs.
My name is Margaret Okello. I'm married with 5 children. I'm a breast cancer survivor for 18 years. I'm a retired teacher. And since then, I would say I do business sometimes, okay? But most of my time, I spend it counseling and creating awareness about cancer. To be frank, there was nothing to indicate that I would suffer from cancer. That means that I was so healthy. I'd actually gained some bit of weight, not too much. And I just felt healthy, no headache, no nothing. But I had gained some bit of weight, and I used to be a bit active, more active actually, but I had kind of slackened. And as I was trying to go back, because my doctor had said, "Hey, Margaret, you have put on some bit of weight." I said, "Doctor, next time you see me, I would have trimmed it off." And indeed, I started running around my house, gearing to go back to aerobics class. And the next thing was that as I was doing that, I accidentally touched my right breast and felt something small protruding. It wasn't big, it was hard. I ignored it and continued for a week. But every time I would touch and feel it's there, fixed. Then I told my husband, and he was like, "Why don't you go and have it checked out and have a mammogram done?" So I went and had the mammogram done, and it revealed actually that there were 2 swellings in my breast, in my right breast. So when I took back the results to my doctor, she suggested that I go and see a surgeon so that they could actually remove them or cut them and see exactly what was in those masses. And when I did that, I was booked in. After a week, I went and saw the surgeon, and I was admitted just for half a day, and they did an excision, that is literally cutting and removing. But as they did that, they found that there was a 3rd one, okay? It was done at Kadik Hospital in Bukoto. And then we took those ones to the pathologist in town, Professor War, I remember, to his lab in town, and was told to come back after 2 days. It was a Thursday, and went back on Saturday. And the results showed that actually they were all cancerous. All the 3 masses but from my breast were cancer. I couldn't believe that actually I had cancer. So I told the doctor, no, there must have been confusion or maybe misplaced results or whatever. But I didn't believe that those were my results. So I was told to come back on Monday. And when I went back, the doctor confirmed that, look here, Margaret, this is it. Don't waste more time. Don't go anywhere. Just go straight to Cancer Institute and start treatment. Now, my problem was, where do I start from? Remember, that is 18 years ago. It's not the way you see Cancer Institute now. So I managed to go to Cancer Institute. I didn't know where to start from. And of course, I was crying with tears streaming from my eyes like a small girl, and with the result showing that I had cancer, and all what was in my mind, I'm going to die. I don't have more time unless I'm helped. So I went crying with my result slip. I felt like I was at the bottom of the ocean, that life was stopping for me anytime, okay? Because by then we knew everybody who got cancer would not survive. Some of my children were still young. My last one was just in P3. Then I'm like, God, this one will never even remember me. So it was quite heartbreaking. But thank God I had a support system. My husband was there for me and my bigger children, but they were not also big. They were all students. So you can imagine, it came at a time I was like, God, before my children even finished studies, but there we were. I had to face it squarely in the face.
My name is Namipago Sylvia Inez. I'm 31 years old. I'm a person living in a lung disease called chronic obstructive pulmonary disease, and also asthma. And I'm also on treatment at the Lung Institute. So I first learned about these conditions when I was in high school. I first developed pneumonia, and I asked for a pass out, but the head teacher refused me to come back home, which later on turned into asthma, as I was told by one doctor in Nolago some years back when my dad took me for a diagnosis to see that doctor. That's when I learned that I had I'm suffering from asthma. But then for the COPD, it was in 2017 when I started developing serious symptoms of coughing, sputum, which had a blood stain in it. I was over coughing. I was always weak. So I spoke to one friend of mine who advised me to go to Mulago for a checkup. I went to Mulago. I was given some tablets, as you know, in Mulago. Then I returned back home. But one day I was walking within Mulago Hospital, the old Mulago. I saw a poster somewhere, and the Lung Institute was carrying out an asthma research. It was a study. It was called ASAP. So I called on the number that was on the post, and I was directed to go to Chirudu Hospital at the asthma clinic. They did a spirometry test, and they found out that I had less of the asthma, but too much of the COPD. So I was referred back to the Lung Institute. That's when I started my journey of treatment at the Lung Institute until now. Asthma mu Luganda kye kirwadde ekyefaananyirizaako endwadde eza lubyamira, oba kye tuyinza okuyita nga lubyamira. Lubyamira bamuyita ssenyiga, naye ku asima omuntu aba tassa bulungi, empewo eno bwekuyitamu oba owulira amawuggwe geekutte muno, owulira ng'alina ebbwa, osika omukka owulira waliwo akantu kalinga akeesikanga rubber band, okukolola okwo ekikolondolo ekitaggwa, empewo buli kiseera. Kaakati COPD kirwadde ky'amawuggwe ekiva ku nsonga ez'enjawulo. COPD oba giyite chronic obstructive pulmonary disease, kirwadde kikwata amawuggwe nga kiva ku nsonga ez'enjawulo, naddala ezisooka omukka gwe tussa oba gwe tusika ogw'obulabe, naddala oguva mu nku embisi, omukka oguva mu buti bw'essigiri bwe tukumisa, obuveera bwe tukumisa amasigiri, emikka egiva mu mamotoka, amafuta ga stoovu. Then abamu bazaalibwa n'endwadde zino okuva mu families. Omuzadde waliwo yali yalwalako ekirwadde ky'amawuggwe naye nga tebakimanyi, kati ekijja kyebbulukukira mu baana oba n'abazzukulu. So COPD ndwadde y'amawuggwe generally nje sisobola kunnyonnyola nti kiri bwe kiti, naye obulwadde bw'amawuggwe obulina obubonero obw'okuwulira obuzito mu kifuba, ne wositula akadomola ka lita 5 owulira ng'oweekeera, osituka ku makya nga tolina maanyi kuba bunafiya omubiri, mugumba. So n'okubeera ng'okolola ekifuba ekitaggwa, ne bakebera tolina TB, ne bakebera ekifuba tolina asima, esobola okwekereza COPD wandiba ng'ogirina ate nga kirina obujjanjabi olwaawo tekiwunza.
How did you feel when you were first diagnosed and told that you have COPD?
I cried in front of one doctor. She's called Dr. Jalia at the Lung Institute. But the good thing, the doctors at the Lung Institute, they are loving and caring and they are understanding. She counseled me, and my question was, am I going to live for a short time? Is this COPD going to turn into a lung cancer? So she told me some of the facts about the COPD, and this has helped me live a happy life. She told me you're not going to die, but you're going to live with this disease because it has no cure. You're going to live with it as long as you're on treatment. You're going to live even until your 90s. You're going to have children and grandchildren with this COPD.
After getting diagnosed with COPD, what has been one of those most pressing challenges or painful experience that you have had?
The biggest challenge is the treatment. Inhalers are expensive. Formonide, Formitral. Then there is the budesonide. Now imagine a patient who lives in Katanga or in any other ghettos of Kampala who cannot even afford to get 3 meals a day, and she or he is diagnosed with a COPD, and they prescribe budesonide as the treatment they are supposed to use, and at the wholesale pharmacy it is at 55,000 shillings, which means many people lose their lives unknowingly, and others, the condition worsens because they don't have money for treatments. Seeing the doctor or the pulmonologist is expensive. You have to pay for the consultation fees, of which the money is a bit high.
But that time, everything you had to buy, okay? Even the gloves you had to buy. Even the mixing of the drugs, it had to be done manually. The doctors or the nurses would mix the drugs, which you have bought from outside, maybe from the pharmacy, because they would only give you the prescription. Then you had to shake it yourself. You are the patient, but you are doing the freaking itself. And really a lot has changed now, but that time it was really difficult. And if the money goes, that is it. Your treatment stops. Whether you have finished the treatment or not, that's where it ends. You would see that you are many coming. Eventually you see the numbers decreasing, okay? The people you know whom you attend with, the same time you see them falling off, meaning they are gone. And of course, also the many tests you do, costly, and they take a long time, okay? For instance, Heart Institute is one. You all have to queue up for that Heart Institute to get your test done, your heart test done. Then also, by then there was only one bone scan, which is no longer functioning as well. So you would book it like a whole week in advance. So, and also expenses. You spend a lot, okay, because everything, there was nothing for free.
Did you experience discrimination or stigma in your community, workplace, or healthcare system because you are living with your disease or condition?
I faced some stigma and discrimination from some of the friends, some of the family members. Some of them nicknamed me nandwadde, like naava oli nandwadde. Bwe oli lunuma, someone who is always sick, who is always weak, or a weakling. So it really hurt me, and to the point that I actually became so quiet. I became so reserved that I started avoiding some family members. I started avoiding some friends because I know if I tell them that today it's too cold and I'm not feeling well, someone will say, little mama, you're a weakling, you're already sick. So
stigma, sometimes you feel it yourself, okay? Because imagine at the end of it all, I had to lose both of my breasts, okay? So you feel it yourself that, look, I'm maybe less of a woman, okay? But of course, when I'm out there, no one would know, okay? Because I've got chiwani, just like people have hair when actually they don't have hair, all right? So really, it's also the way you respond to the issue at hand yourself, okay? But I had a lot of counseling, especially from church and from friends who counseled me. And I said, well, I'll have to go for it because I wanted to live. I really wanted to live and see my children grow.
Stroke is one of the leveling NCDs in Uganda, and it causes most of the deaths in hospitals in Uganda. Stroke is a brain damage or a brain injury, which is caused by either a blast of a vein, a blood vessel leading the blood to the brain, or it can also come as a result of blood clots. Stroke is caused by very many causes, which includes hypertension. As most of the patients we get, that's the major leading cause of stroke. Hypertension, diabetes, high cholesterol levels in the body, poor diet, like lifestyles, the way we live as people, that the food we eat, most of us eat fats, and it can also cause stroke. Stress can also be a leading cause of stroke. Stress, sickle cell in young kids, cerebral malaria, and many other causes, but most of them, those are the leading causes of stroke.
Okay, so tubulireko ddi wamanya nti oyina pressure ne sukali era walabira ku bubonero ki nti obirina?
Atoka mpulira nkalamata njagala nnyo okunywa amaggi ssaawa era inda tewulira bulungi lezidini nga ngenda budde amaanyi nga sikyalina maanyi bulungi niŋŋamba kangendeko mu basawo bankebere era ebiseera mali beera makerere yenda emulago kati eyo emulago nyekula obutawo nankebera bwe kuŋŋamba nti naddula pukaali ye pureesa awo nentandika amakerenda era ne bampa kaadi nga ngijja mulago nga wenzisa eddagala eryo.
Owulira otya nga bagambye nti oyina pressure ne sukaali?
Tawulira bubi nnyo oba ne taata wange era twali tunywa naye eddagala emulago nze nalimuleeta emulago nange lenzuula obwange byawo nataperawo kumina ddagala era talivaawo paka nakati.
The leading challenge, as most of them, it is physical disability. Because stroke, as a result, it comes with physical disability, where someone can't walk, can't do ADLs or activities of daily living on his or her own. He or she needs help. That's the major problem faced by all stroke survivors, not depending on the background, whether they are poor or rich. And another problem faced by stroke survivors, for example, those in the poor background, not accessing the health facilities of physiotherapy, because in most cases physiotherapy is expensive, and in our health centers which offer free services, it is not vibrant in those health centers, or you can find they don't get what is enough as those who can afford it.
I want to appeal to 3 categories of people. Category number 1 is the healthcare providers. So in managing a patient with a non-communicable disease, the health worker should do endeavor by all possible to ensure that the patient is involved in their own care. Listen to them, give them time so that you can be successful in managing them. But I'm also appealing to the patients themselves. That is your role, to ensure that you follow the doctor's advice and instructions and seek clarity to whoever is giving you help, but also be sure to look for help wherever you can get it. Professional help, that's what I mean. Don't wait and complain that there are no medicines in the hospital and then you go and sleep and wait for the next supply. Look for medicine and swallow them. Go complain when you know you have already taken your medicine and when you already followed the instructions of the healthcare profession.
NCDs are with us. They're increasing in the pandemic proportions. They're the biggest killers we have in the world now. And controlling them is you and what you do, what you eat, what you put in your thoughts, the type of exercise you do lies in your hands. So prevention of these diseases lies in your hands. Please don't wait for symptoms because these conditions are largely asymptomatic. Whenever you have a chance to have them screened, have them screened. And for those of you who already live in the NCDs, please keep on your medicine. Honor your appointments, read around, ask about them, ask the health workers about them so that you have enough knowledge in managing them.
Behind every life touched, there are people working tirelessly to make a difference. The Uganda Non-Communicable Diseases Alliance, UNCDA, is at the forefront of this fight.
He started when there was a vacuum and nobody was filling that void of preventing and controlling non-communicable diseases. So as we are successful, we started the alliance, which was made up then by 3 member organizations: the Uganda Cancer Society, the Uganda Diabetes Association, and the Uganda Heart Research Foundation. And since then, the alliance has slowly metamorphosed itself. It has also attracted many organizations, those that deal with diseases of lifestyle, those are chronic NCDs that are behavior-related diseases, but also other LCDs that whose risk factors are non-modified, like sickle cell, mental and neurological conditions, injuries, and diabetes type 1, among others.
Uganda Non-communicable Disease Alliance, UNCDA, was founded in 2010 by Professor Andrew Marcel Otim, Professor Charles Mondo Kiza, and Dr. Charles Orem. Now, these 3 gentlemen, and Professor Otim was coming from Uganda Diabetes Association, was the president of Uganda Diabetes Association at that time. Professor Charles Mondo was the president of Uganda Heart Research Foundation, and Dr. Orem was the president of Uganda Cancer Society. So initially, those 3 organizations, Uganda Cancer Society and Uganda Heart Research Foundation, founded the Uganda Non-Communicable Disease Alliance. So our vision, or the vision for the UNCDA, is a society without preventable NCDs, and we also have a mission, and the mission is to lead the civil society organization response against non-communicable diseases by placing people's health at the center of the national agenda through advocacy, empowering and inspiring the population. As we do that, we are governed by values, and these values consist integrity, accountability, while putting our patient at the center of all this, and professionalism, innovativeness, equity as some of the other goals, other values we cherish at UNCDA. What is our goal at UNCDA? Our goal at UNCDA is to steer the civil society response in prevention and control of non-communicable diseases in Uganda in order to achieve the global target of 25% relative reduction of NCDs by the year 2025. In fact, as I speak, we are already in 2025. We are going to evaluate ourselves and see whether we have achieved this goal.
Within the region, we are almost the first NCD Alliance that's within the East African region. And from that, our founders, the Danish NCD Alliance, supported us to reach out to other countries within East Africa, and we allied it together and formed the NCD Alliance East Africa, which is an umbrella organization that brings together NCD alliances within the East African region, Kenya, Rwanda, Tanzania, Burundi, Zanzibar NCD alliances to form the East African NCD Alliance. But coming back home, as an organization, we reached out and formed 10 branches that are distributed within regions. In the north, we have Guru and Arua. In the east, we have Tororo, Serere, Amuria, and Luka. In the west, we have our branches in Kasese, Shema, Vishenya, and Mbarara. Then in the central, we have Mubende, Kasanda, Nakasongora, and Kampala Metropolitan, where our offices are situated. So initially, we had 10, but now we've moved to beyond 14 branches, and in those branches we have supported health workers and health and communities to provide NCD services, create awareness, and advocate.
Having had all that, what are your recommendations to the government of Uganda to enhance NCD services in the country generally?
Yes, thank you. In order to improve NCD prevention and management in this country, you need a multi-sector approach. So you realize that the number of players that are involved in all this. We have the general public, the Minister of Health, Minister of Education, we have the Minister of Transport, just to mention but a few. But going back to the parent ministry, which is the Minister of Health, the number of asks we have for it, number one is to increase the funding. We ask the Minister of Health through the NCD department to increase the funding for awareness campaigns in the community, awareness campaigns through media talk shows. You realize that non-communicable diseases are majorly symptomless. So many patients do not know that they have them, and when they have them, they present with complications. And one way of dealing with that, you can start with the targeted screening, but in some cases, we may need universal screening of the general public if we are to prevent communicable diseases.
I believe that the government should do more in the creation of awareness about these NCDs. All right? Because in most cases, people come when it's too late. However much treatment they put out there is not going to benefit the communities or the public or the people because it's already too late. For instance, I would say cancer. If you come, you're stage 4, however much they do, whether you go abroad, you get the same results that in most cases people will pass on. All right? But if they get to know the risk factors, they get to know how to identify or to detect that cancer early and diagnose it early and treatment, the right treatment given, then there is hope that people can live. So much more money should be put into awareness and sensitization.
The other ask we have as UNCDA to the government or the Ministry of Health is to increase funding for the training of health workers. You need health workers with good skills to tease out non-communicable diseases from the community and also to treat. As realize, non-communicable diseases like diabetes, hypertension, even now and then their science keeps on changing. The evidence keeps on changing. We need a health worker who is all abreast with all these scientific advancements.
These doctors to be brought on board and be trained about our diseases, about our lung diseases, because most of them, they don't know. If you tell them, I have a COPD, what is a COPD? And this is a doctor you're talking to, you need help, you need to be treated. With my firstborn, I wasn't aware that I had a COPD, but I knew that I had asthma. I got an attack because it was in the night at 10 p.m. I was on the window bed, so the midwives told me to remove my dress. Since that time, I had refused because I knew my problem. I told them I'm not fine being naked because I'm asthmatic. So when time reached in the night, they told me you're about to give birth, please remove that dress. I had to remove that dress, and immediately I removed that dress. Remember, the windows are always open to avoid infections of TB and other diseases. So I got a serious asthma attack. When I started wheezing, I almost lost my life. They had to rush me to the operational theater for a C-section. Now for my second born, I explained to the gynecologist at the ward, the doctors and the midwife was there. But they refused me to go to the theater. They forced me to push. I nearly lost my life because my baby's head was out at 3 p.m. But I failed to push him until 8 p.m. in the night. It was only by the grace of God that he remained alive, and I was also saved just by the hand of God. So we are forced to push, yet our lungs are not sometimes in position to push because once the doctors don't know anything about these chronic respiratory diseases. They are unaware. For them, their job is about delivering labor pains, and that's all.
On top of that, to let the curriculum, even in schools, let these NCDs be included in the syllabus, the way HIV was. Okay, so people can know what causes, what are the causes. We may not know the exact causes, but at least if the risk factors are taught about, okay, then people can at least try and do what? And reduce all those risk factors.
But also want to ask the government to emphasize more on prevention and control rather than concentrating on treatment, because sometimes the treatment is very expensive. People report with complications when it becomes very expensive or even impossible to treat. So government should emphasize more of public health, that is health education, and then early diagnosis, streamline the referral system or the referral pathway so that people can get treatment early and palliative treatment so prevent complications.
Every heartbeat tells a story, and every story carries a truth. Away from the white coats and clinical terms, life unfolds raw, unfiltered, and deeply human. These are the echoes of courage, the moments in between, where living with an NCD becomes a daily act of defiance and hope.
Stroke is curable. Also, that people think it is not curable, and the moment you get stroke, everything is done. But I can say stroke is curable, and we have survivors who can give testimonies that a stroke is really curable. Though in most cases, every person has their own life, and every stroke is different from each other. Like, this stroke is not the same as the other person's stroke. It comes, it occurs to a person, and it leaves different effects. So your effects, it might take 2 years to heal or to cure, and another one's effects might take 10 years to heal, so it is different. But stroke is curable.
So we can live with NCDs. We do not have to die from NCDs, okay? If we are diagnosed, let's adhere to treatment, adhere to reviews, going back and be rechecked, not because it's not a once-off thing. You always have to come back and you are assessed by the medical people, okay, or health workers, so that you can know that you are on the right track.
Abantu abasinga bafunye okusomozebwa mu kintu ekyo kyoyogeddeko ekya obuteeraliikirira. Oyinza okukola otya, okisanze otya ekyobuteeraliikirira, kubanga okweraliikirira I think kusomozeza bangi mu pressure.
Okwewala okweraliikirira kuba kubi. Kuba yensonga endogera yatuuka ne ku stroke eno. nagenda nefuna omwana wange namenyeko okugulu. Awo netegeka ogenda okukola ki ng'okumulaba. Era nendaba olunaku yengenda mulaba. Ne mutuukako nulengera. Kati awo etenagandukira okugwala stroke n'enkuba. Nagenda okulaba nga amaanyi gakwete.
Yes, this goes to my fellow born-agains. Let's stop saying or claiming that each and every pains that we have, it comes from the devil. Some of them are diseases that can be treated in hospitals, and by the grace of God, people can be healed. Some of them can be on treatment and live long for so many years. So, abalokole, the pastors, the reverends, but most especially abasumba balalokole, n'amakanisa g'abalokole ababulisira enjiri, endwadde ez'amawumpwe za ddala ziruma ate zitta. Omuntu bw'ajja gy'oli nti musuma nsabire ekifuba kinnuma kinnemeddeko, ogwo si muzimu gwa kifuba. Musabire omuwa amagezi agende eri abasawo abakugu mu mawuggwe bakebere ekirwadde ekimuluma, bamuteeke ku treatment, musabe eddagala limukolere nga n'okusaba omusaba. Naye so si kubasiirisa bisiibo, asiibe ate oluusi ekisiibo kiyinza omutta n'okusinga obulwadde olwalinise. So bambi tukkirize nti endwadde weeziri n'abasawo weebali, Katonda yabatonda waali n'amagezi ye yagabawo n'eddagala nagalizuula.
I would say cancer is curable because I'm alive. Okay, I was lucky that my cancer was found when it was stage 2. All right, but I also adhered to treatment, and also for reviews. Every year I come back and I'm assessed by my doctors. So for 18 years, I haven't really had cancer reoccurring, okay? Although we know that it does reoccur, all right? But that's why the need for you to come back for reviews, okay? So that you are assessed. And if there's anything, it can just be malaria, but you don't know that it can trigger other things as well, or the recurrence of cancer. So it's always, whenever I'm not well, I always run back to Cancer Institute to be assessed. Even when I'm well, cancer is curable if detected, diagnosed, and given the right treatment. You can live your life. So cancer is curable, but most cases, if it is found early. So the issue is to have a checkup.
The fight against NCDs isn't in clinics alone. It's in our homes, our schools, our choices, our voices.
Through our advocacy and awareness raising, we have conducted a training of the media organizations or media personnel on prevention and control of non-communicable diseases. And through that training and awareness, we have had non-communicable diseases prevention and control matters being broadcasted in almost media houses or media outputs. So across the country, the level of consciousness on non-communicable diseases has gone high or has increased. So today, you cannot get information in the media that talks about health without talking about non-communicable diseases.
Cancer treatment is not the easiest. One, it involves, especially breast cancer. I had surgery, I had chemotherapy, I had radiation, then I had hormonotherapy. So I will itemize one by one. I started off with chemotherapy. After the biopsy and receiving the cancer diagnosis as being positive, then I was started on chemotherapy. Chemotherapy is the most dreaded treatment in cancer. It really weakens you. It has a lot of side effects because it's a concoction of so many drugs. But again, I would say, according to me, it's very effective. That's why I'm alive, all right? Chemotherapy, the first day I was told I lost all my hair. I had very long hair, but I lost it because of the side effects, okay? I could not eat for a week because I'll bring up whatever I ate, okay? I darkened, okay? My hands were like, I sold charcoal, okay? I was a charcoal seller, in quotes, because I was all black. My feet and everything, the nails would want like to come out. So those are real serious side effects and people dread them. My mouth, I felt like I had never brushed my teeth and globed with sores. But after like a week, I started feeling a little bit better, okay? Started eating slowly. And then by the time I reached my climax, like I'm feeling much better, then it's time to go back and have another cycle. So you have a graph of up and down. You reach up and then you have to come down to the bottom. So that chemo is actually not a very friendly treatment. So after finishing 4 cycles, then I was told I had going for surgery. And my doctor said, you know what? Go and redo all the tests. And I had to redo all the tests. I went back and had a mammogram done. This time it showed that I also had 2 lumps in my left breast, which was not the case at the beginning. All right. So after getting all the results together, then the doctor decided, Margaret, we are going to remove 1 breast initially, but now we have to get to do both of them, to get rid of both of them because they are all diseased, meaning that they all had cancer. Of course, the family didn't take it well. Some said, no, don't do it. Others told me, go and have herbal medicine. So many, everyone had their own what? Own advice. But my doctor told me, don't listen to anyone. It's your life. And indeed, I said, I'm not going the herbal way because someone was, actually my own young brother was convincing me to go the herbal way, that people survive, you don't have to go and have surgery. But then I said, bring me one person, show me one person who has actually who has had herbal medicine and is alive, but there was no one. I said, I won't go that route. I went also for prayers. All the same, thank you for your prayers, but I'm going the right way. I'm going to have surgery. I said, you have little faith. That one, I also took it in. So you have people advising you because everyone is trying sometimes to be helpful. But anyway, I decided I'm going the right route through Cancer Institute. So when I had surgery, it took me like a whole month to get back on my feet, okay? After that, not in hospital. In hospital, I spent 11 days. But when I went back home, then I was put back on chemo. Another 3 cycles of chemo. After finishing, then I was told that I had to go for radiotherapy, for radiation. I went to the radiotherapy unit. The way they say it in Uganda, they call it kukalirira. I thought they were going to roast me black. The way you see the roast meat, I thought I was going to get burnt there and I come out like roasted black meat. But thank God it's not it, okay? You hardly even feel the least heat, okay? But of course, there are side effects, but I thank God that I never had any side effects. And I finished the 5 weeks, every day, Monday to Friday, going in for radiation. And after that, the doctor told me now we are going to go on hormonal treatment. And I was put on tamoxifen, which I took religiously, 1 tablet a day for 5 years, okay? The only side effect I can talk about is like I put on weight. That is all. You get that fear, you think that it's the end of the road, okay? You are not going to make it. But when you get a survivor talking to you, you get hope. Because me, I was talked to, though it was the day I was going in for surgery, my namesake also called Dr. Margaret Okello came and counseled me. We had not met, we just met and we found actually we had the same names, and she counseled me, and from there she became my sister because she had gone through it herself. Okay, and she gave me that hope, which I believe that everyone going to start cancer treatment needs to go to be talked to, so to allay those fears.
Hearing all that, how has UNCDA supported persons living with NCDs?
As an organization, of course, our slogan is empowering people living with non-communicable diseases. And we started by creating awareness on NCD risk factors, the NCD risk factors which include unhealthy diet, physical inactivity, cutting down alcohol, excessive alcohol consumption, and the use of tobacco. Those are the major risk factors. So we campaigned against the major risk factors, but also created awareness in the public by all prevention. And when people heard about the NCD risk factors and NCDs, as they said, then what? So we went into screening. When we screened the people, then the question was, you screen us when we are sick, then what? So now we started training health workers and supporting some facilities to do diagnosis and then enroll patients and treat them. Then the numbers of patients increased in the facilities that we supported. The next question was, then what? So then we came to Minister of Health and said, but please, supplies and medicines are in shortage in the facilities because of living with NCDs. And so Ministry tried to increase on the medicines, but they were not enough. Then that's when we started bringing people in groups to ensure that they can supplement on the commodities that they need, stress supplies. But also, the other thing that we say we have helped people with NCD is through our advocacy, especially on the medicines, that currently they have increased on the supplies, but they have also changed some molecules that were not so effective, or those on that were had a lot of side effects, to better medicines that people living with NCDs can get. So that's how we have been able to help people living with NCDs, but also creating education and training health workers to ensure that they can manage them better.
Together, we can change the story of NCDs.